purpose of this event is to share with the faculty and our visitors the interesting work that our students have done. This is the culmination of their internship experience. This demonstrates all that they've learned through their course of study here that they've put in these posters. So it's a way of kind of summarizing what they've learned and what the outcome of this particular project that they've done here is. We get about 50, 60 students that will do it in the spring and smaller numbers in the fall. In fact, we've got so many students here now, we need to rotate those, and we'll have multiple sessions that we're offering here where they get to present their posters. Yeah, we've switched to a new format this time. It's a little bit of a challenge with the number of students that we have because we've had smaller numbers before this. Everybody's going to electronic format, and when you go to professional conferences, you see presentations are all in electronic format. So we decided to shift away from the old paper poster and go to a new format. It's more realistic and something that students are able to share with potential employers or others on down the road. So it's more like it's something that they're more likely to be able to use long term than an old paper poster that usually found in the trash can afterwards.
The title of it is Developing and Implementing Healthy Relationship Lessons Among Students with Intellectual Disabilities. So we, the College of Public Health, Dr. Orpinas and I partnered with the College of Family and Consumer Sciences to work with UGA's Destination Dogs. It's a group of students who attend UGA and they're students with intellectual disabilities. They live on campus in residence halls, they attend classes, and for the majority of their lives they have been excluded from conversations about healthy relationships and sexual health. So we worked together to create a couple of lessons that we implemented to those students. And those were focused on dating, relationships, intimacy, the relationships with their friends and their caregivers, and kind of navigating that space at UGA as students. In terms of the takeaways, we need more of these lessons. All of the students indicated that. So I worked with a partner, a fellow MPH student, and so I did the healthy relationships component, and then she did the sexual health. So I would say in building on the two together, that's really important. So in the future, focusing on establishing that rapport from the very beginning with the healthy relationships kind of lays the groundwork for that sexual health piece that's so important. They have a more difficulty, picking up on some social cues. They're also at higher risk of being sexually abused. And so we talked a lot about how to navigate consent, how to skill build to give them the tools to say, no, I'm not comfortable with this, or yes, this is something I'm interested in. So in the future, they can actually put these skills to use. So we did scenario type activities, and we talked about kind of the impact of social media and technology on their lives, again, as they're navigating dating, because that can really add another level of confusion and complication. So we really focused on that. And then we worked with Dr. Lisa Ulmer from the College of Family and Consumer Sciences on campus, and she is the supervisor of the Destination Dogs program. So we worked really closely with her to learn more about her students, to get to know them, to get to know the needs of the program, so that in the future we could continue this program, because these Destination Dogs, it is a program that will continue at UGA, so how to keep this going in the future. I am in the process of applying to jobs. I would love to continue working with healthy relationships, sexual health within higher education, so talking with students about how to navigate college life, wellness, and kind of that impact of sexual health and wellness as well. So we'll see, but that's what I hope to do.
Well, I basically study HIV-infected populations in Uganda. My theme was to predict whether mental illness can occur based on our baseline CD4 counts. And so basically what we found was that people who were below a certain amount of CD4 count, which is 500 cells per milliliters, they actually had the highest propensity for mental illness, even after starting therapy, even after years later. And that's really useful for us in clinical situations where we have low resource settings, because sometimes mental illnesses are not screened universally, especially in kind of impoverished countries, because they don't really have the infrastructure to do so. So if we can have a predictor that will allow us to identify which patients will become more likely to become sick before they even start therapy, we can already start targeting kind of information towards them, resources towards them, and treatment towards them. So CD4 counts as our T cells or white blood cells that help us, keep us healthy. These are a part of our immune system. And so basically HIV attacks these CD4 cells, but that makes us sicker. So the lower our CD4 count cells are, usually the higher the viral load and vice versa. And so basically what we found was that though people are lower than 500 milliliters become sicker even after therapy. So we're going to hopefully target interventions towards those type of people. Well, basically, we do an integrative care at the time of treatment. So when they come in with their baseline, when they're identified as having HIV, when they come in for ask them some baseline questions, they get their clinical data, they get their how long have they been HIV positive, or what kind of risk factors. We will already start introducing care for them, maybe linking them to mental health care, mental health institutions, maybe even to a support group. So those kind of services that we automatically link together. And the really importance of this is adherence. So people who are not taking their medicine because they're sad or depressed, then that affects adherence a lot, which can affect mortality. I partner with my advisor, Dr. Sakandi, over at the Global Health Institute in the Epidemiology and Biostatistics program, and I used parts of her research that she was doing over in Uganda as well. So that data set came from her and her current research. I definitely want to study the HIV/AIDS route and mental health illness. I think that's a really good niche that haven't been fulfilled yet. So hopefully if I could get into that area, I'll be all set. Yeah.
I did a systematic review on 3 diseases from hunted animals that could spill over into human hunter populations. So I focused on brucellosis from feral pigs, tularemia from hares, and then chronic wasting disease from cervids. I specifically chose 3 different diseases that were one from big hunt game, one from small game, and then one from other. And I hope to show that there was a risk in hunters from these 3 specific subset of animals. For example, in brucellosis from feral pigs, I found several studies that showed that from 65 to 85% of hunters actually didn't use proper field dressing techniques, which could cause them to get brucellosis. So brucellosis is normally, you can get it from dairy, you can get it from livestock, and you can get it from feral pigs. But in the U.S., we've actually gotten it out of dairy. We actually make people vaccinate their cows and stuff. And the only livestock, animal really that has it is elk in the Yellowstone area. So what's left is the feral pigs. So I found that we probably do have to worry about chronic wasting disease from cervids, because even though we haven't found that there's actually any cases where it's spilled over into humans, the fact that I found that there was proof for distinct strains, and these distinct strains actually had different characteristics, that this doesn't mean that this couldn't happen in the future. And also that there is a lack of data on how much tularemia is in hares and other animals, and what exactly hunters do when they hunt. Do they use gloves? Do they use masks? Do they eat while they field dress? There's some studies on it, but a lot of them just focus on the gloves part, and that's not the only thing that could cause a spillover event to occur. I'm currently looking for a job in Nashville, and I hope to work there for a few years and then apply for a doctorate program for infectious disease epidemiology. And then after that, I would like to work for the Epidemic Intelligence Service, hopefully, but we'll see.
So we conducted a policy diffusion analysis. We were looking at the state-level political and demographic characteristics that play a role in MCL adoption, medical cannabis laws, limited to the years 2000 to 2016. Kind of the initial key predictors of interest that we were attracted to was tracking the impact of campaign contributions by pharmaceutical companies. But running those through our models, we found that it didn't actually have that strong of a predictive characteristic. What we did find was that the percentage of state legislatures that are female and Democrats, those were our strongest positive correlations, and then to a lesser extent, the state's unemployment and poverty rates. One of the targets of this study was to add to the current literature. I think that there's a lot of nuance, a lot of complexity when it comes to policy diffusion, especially with medical cannabis laws. because a lot of the progress it happens at the state level. So yeah, we were targeting state legislatures and the elective processes for that. We built multiple models to kind of take into account some of that increased complexity. So not just looking at whether or not a law was passed, but considering the functionality of that law, the type of law, whether it sets up a dispensary system, allows for home cultivation, and functionality kind of includes the access, is it changing patterns of use, of some other impacts on the healthcare system at large. So I think that there's just kind of a call for more research involving increased complexity. Because a lot of what we have to do is reduce things down to a dichotomy, yes or no, 0 or 1. And I think we're just trying to translate into kind of more of the nuance that we see in real life when it comes to how these impact people's lives. I am so excited about the next chapter. I've received an offer to join the Kaiser Permanente team, so I'll be heading out to Oakland, joining an internal consulting team, it's special to me as a dual degree student. I'm going to be able to use and leverage a lot of skills and critical thinking that I've developed in both programs. That's exciting, and I think that it's a great opportunity for me to thrive in KP parlance.
I studied community engagement strategies. So it was a case study actually using a collective impact model, a local one. And I wanted to advance the conversation about the importance of community engagement strategies in communities of color. We had 6 intentional community engagement strategies that look to place the community voice at the forefront of this collective impact model. And the collective impact model is a comprehensive, large-scale framing network for health promotions and other like fields. So we had 6 intentional community engagement strategies, and what I wanted to do was situate them inside of the collective impact model, just highlight how important they are when you go about making large-scale changes in communities and making sure that the target community, the community you're looking to have their behavior change, you want their voice and their input to be at the forefront of that change. The local initiative looked to assess community violence and youth gang involvement in the Athens area. They thought it initially was a youth gang problem, but by the end of the research, what we found out is that we actually had a youth development problem, right? And the youth really wanted jobs, and they needed more activities after school because they needed connection and community. So I think the biggest takeaway was once we involved the community in actually looking into this problem and digging around and seeing what the problem is, we found out that the actual problem is that youth need more activity, and youth transitioning out of high school and more into adulthood need employment so that they could take care of themselves and not look for to have money and get money in ways that were illegal and would perpetuate violence in their neighborhoods. I actually was a researcher for the Athens Community Partnership for Youth Development, and the PI on the research project was Rebecca Matthew, and she's with the School of Social Work. So I'm so excited. I am headed to St. Louis, Missouri to attend the Brown School. I'm going to get a PhD in social work. I would really like to still be in academia. I would like to work at a HBCU, which is a historically Black university, and teach social work or instruct social work. And I also would like to do more community development work and work with these larger models for change and be this mediator for the target community and these larger institutional partners. That's where I see right now. That's where I see my fit and where I see the most important place I want to be right now.
For my capstone project, I did a exploratory literature review, and it grew out of some data I came across in which a lot of my interests coincided. And that was from the 2015 National Survey on Drug Use and Health, which found that out of 1.7 million older adults who have co-occurring disorder, there were 422,000 who didn't receive treatment. So what I set about trying to figure out was what was going on, and then I had an intervention in mind that I wanted to see if it might be a possibility for addressing this issue. So as a backdrop, there is a public health problem of some significance that's occurring. The number of older adults with mental health and substance use issues is increasing, while the number of people to support them is decreasing. And so I was looking into acceptance and commitment therapy as a form of intervention that might help. What acceptance and commitment therapy tries to focus on is accepting, and then whatever the issue is, connecting with their values to take committed action to still live a life that's in meaning, that is a meaningful life in accord with those values. And so what I found really interesting was that there are gerontological theories that sort of relate to each component. So, for instance, in the acceptance component, that's very close to a theory called selective optimization with compensation. And that theory says that older adults, and it's been validated, as they age, they focus more on the things they're still able to do, and they let go of some of the things that they're not so good at anymore, and that helps them maintain their levels of well-being. And then another gerontological theory is the socio-emotive selectivity theory. So basically, this holds that as people age, they sort of unconsciously go through equations where they say, I have this much time left. And as that shortens, they start living more in accord with their values. And then the final part of ACT that I felt really coincided with older adults is it's a gerontological theory called stereotype embodiment theory, which basically holds that older adults will start to believe these things about themselves that they're told: old, frail, diseased, early death, etc. And then there's a few long-term studies that have just been completed that really confirm this. What I found in the end is that it probably would be a useful intervention because in addition to these sort of intersections, it's also very portable. It's been delivered via web, telephone, in group format, one-on-one, and then even with unlicensed workers. And so there's all sorts of uses for it, and my conclusion was that it warrants further research and it could be a very useful way to address a lot of these issues. My interest and what's actually my lifestyle is healthy aging. When I was exposed to a lot of the concepts a couple of years ago in some of the upper level gerontology courses I was taking, I really brought these into my life, like the 10,000 steps, just a lot of the things that are recommended, and have found in my own life that it's yielded lots of beneficial results. And so I'm really interested in that. So I wouldn't mind working maybe CDC, they have a whole healthy aging area, or research in and around that. But with the dual degree, I also have the ability to work one-on-one with folks. So yeah, I just see myself somehow, some capacity, working in a way with older adults, hopefully healthy aging. But there's many other opportunities they're given me by having this dual degree.
So I looked at the puppy raisers that are here in Athens. A lot of people know them as the people who have the puppies in the yellow vests. You see them around campus all the time. And my main research focus in my 2 years here was pets and disasters. So my idea was that people who have to bring their dog with them everywhere they go would theoretically be more prepared if something were to happen. So I sent out a survey to their listserv and basically asked them generic questions like, do you have an evacuation plan if something were to happen here? Do you have somewhere to go? When Irma hit, did you prepare supplies for your dog? So questions specifically related to what they would do for their animal. Even questions like, does your animal make you feel more or less safe? It was kind of interesting findings. I thought that people who had raised more than one dog would be more prepared, just because they're more exposed to having the dog with them all the time. But actually, people who were doing puppy raising for the first time were more prepared than the repeat raisers. The first-time puppy raisers were more likely to evacuate for Irma when repeat raisers all said, no, I wasn't going to go anywhere, I wasn't going to evacuate. And the first-time puppy raisers were also more likely to grab supplies more than just food and water. I did it with Dr. Sarah DeYoung, who's in the Institute for Disaster Management building. She does more work with the undergraduate students, but she's doing a big project right now with the most recent hurricanes, and she's looking at how pets were managed, or how evacuees kind of dealt with their pets, if they had any, when they had to evacuate their area suddenly, and people who helped coordinate the pet response. Well, hopefully I can land somewhere in a nonprofit that does response and preparedness for people and their pets. The nonprofits are usually the ones who do the most for the animals when something happens. Those are usually the ones you see like all over the news, or the ones supplying all of the food and spare vet care and stuff like that. So in order to get the most involved, which is what I would love to do, I think I would love to help work with a nonprofit in the future.